All right. Welcome to the Ultra High Net Worth Clients Podcast. I'm your host, Chris Broadhead. Today's incredible business founder guest is Dr. Amy Beckley. Dr. Amy, can you please introduce yourself and tell us a little bit about you?
Yeah, it's great to be here. My name is Amy Beckley. I'm a scientist. I study hormones for a living. I had a personal battle with infertility and recurrent miscarriage that just got me really passionate about hormonal health for women and trying to advocate for more information so that we can help women get pregnant. We've actually launched into perimenopause as well. And so we really want to decode the menstrual cycle for women and understand hormones so that she can thrive and live her best life from first period to last.
Amazing. That's an incredible mission. So you were a scientist before. What type of science did you focus on?
So I was doing breast cancer progression, and I was studying what happens to a breast cancer cell that makes it deadly. Cancer has different stages, right? The first stage is if you get it early, you can just take it out and take a biopsy and then you're good. But if you get down to stage 4 and it's metastasizing, then it infiltrates all your organs and it's really harmful. We were trying to understand what is it that is inside that breast cancer cell that makes it metastasize and become deadly. And it was a hormone signal that switched. And so it was pretty cool, doing a lot of fun stuff. And then I switched to vaccine development. So I was making swine vaccines, so pig vaccines. This was a big problem in China with the pork industry and swine diseases. And so we were trying to understand how do we make vaccines so that we don't have a problem with our pork production.
Yeah.
So totally different.
Was the entrepreneurial founder path, was that on your radar, or how did that go?
The reason I got into science in the first place was when I was 16, I was having really bad headaches that would put me on the floor of the bathroom. I couldn't get up. I was, puking, vomiting constantly. My mom would take me to doctor, and they're like, "Oh, it's just migraines. It's just migraines." She's like, "No, there's mom's intuition. There is something going on. I don't know what it is." And so finally a doctor was like, "Hey, well, let's just get her an MRI. Let's rule it out." And sure enough, there's a huge brain tumor that was cutting off the circulation. I had surgery the next day, totally benign, didn't metastasize, all good. But I was kind of left with this like, man, if my mom trusted that first doctor who was just going off of statistics and what they knew and didn't kind of go that extra mile to truly understand and kind of think outside the box, I probably wouldn't be here. And so that's what really got that passion for science and medicine and learning more. I actually went to college as a pre-med major and absolutely could not stand needles, stitches, blood, any of those things. And so I switched to kind of like the back end. So like the med device pharma part of it as like I can still understand and make devices and things and help. I'm just not going to be the doctor. I'm going to be kind of the support system for the doctors.
Oh, wow. That's incredible. Awesome. So you had a focus on science from this horrible experience or great experience because you figured, and then you focus on hormones and swine vaccine, and then you're having some struggles with pregnancy. And that sounds like that was the genesis for the business.
Yeah, I mean, I'm a scientist. I've had like 20 years of schooling and training, and I, wanted to get pregnant, and I learned how much I didn't know about my body and my hormones, and I learned that doctors and healthcare don't know anything about women and their hormones as well. It was, you need to be trying for 12 months, you need to have multiple miscarriages. OBGYNs know nothing about fertility. You have to go to reproductive endocrinologist, and then they're taught, how to do IVF. And so you kind of miss this section of time where it's like, what if there's just something simple or easy that we're missing? And so I had a hormone imbalance that basically prevented my body from carrying a pregnancy. And so here's some science. The menstrual cycle is controlled by two major hormones, estrogen and progesterone. And so in the first half of your cycle, you make all this estrogen, you release the egg, and then your ovary makes a second hormone called progesterone, which supports the implantation of the embryo and the growing fetus. And at any time during that pregnancy, if your progesterone drops, it causes miscarriage, preterm birth, a host of things you don't like. And so progesterone is essential. It's the pro-gestational, pro-pregnancy hormone. And I had said, well, maybe I just can't get pregnant because I'm not making enough progesterone. And they didn't have a proper diagnostic or blood test or anything that really could answer that question. And I'm like, that seems ridiculous that we don't know. And like, well, because hormones fluctuate. You know, you have a 28-day cycle and your hormones are low, then they go up, then they go high, and it's really hard to time the right time. And we don't know if it's, you know, if we time it on this day, is it still up on these days? And so that basically was like, well, we need to know more about the menstrual cycle. We can't give this excuse of it's too hard to measure. We just need to find a better way to measure it. And so that's how PROOV was born. So we're a urine-based diagnostic that women take at home, and they take them over the course of the cycle to understand those patterns of those hormones. And so there's those two, estrogen, progesterone, but then there's two from the brain, LH and FSH. And so we look at those four hormones across it to understand, you know, is a normal ovulatory cycle, is a normal menstrual cycle? Is there something in there that's telling us, you know what, this could make it more difficult for you to conceive or to hold a pregnancy? And then we're finding that these things aren't just fertility related, they're life related. This progesterone hormone, if you're not making enough, causes heavy periods, painful periods, PMS, the early symptoms of perimenopause, because that's the first hormone that goes. 85% of women have issues with their periods and their hormones. And there hasn't been a good way to measure that and understand and correct it. Women are missing important board meetings. They're missing days of school. They're leaving the workforce in their 40s because they have brain fog and they can't function in the boardrooms. They've spent their entire career building and building to get to the pinnacle. And then perimenopause hits and they can't function anymore and they have to leave the workplace. I think a study was like $32 billion of lost work and productivity for women over the age of 45. That's ridiculous. And so that's, you know, really the goal of PROOV is to understand hormones on a higher level, what the fluctuations mean, and more importantly, what's the fix? What's the solution? How do we help her thrive and not have this crutch of heavy periods or painful or brain fog or anxiety or depression or I've heard rage, poor sleeping, you know, all these things that women just,
Yeah.
we don't need to live through that.
Yeah. That's amazing. How does PROOV help? It shows you how your hormones are performing,
Yep.
and then you can adjust based off of that.
Yeah, so on the fertility side, we help women understand, you know, are their hormones in optimal range, and we flag things that aren't. And we've partnered with doctors who can prescribe medications to correct hormones
Hmm.
back to the optimal levels if that's the issue. We also have supplements. So if they don't want medications, they want to use an herbal supplement to help them regulate their cycle. We can help support healthy hormone function with supplements. On the perimenopause side, there's just not very many trained physicians in this space, and they go by symptoms alone. And so women just don't have education or ownership of their body. They don't know what's going on. And so they kind of have to rely on this doctor who may or may not have the best education. They might not have studied this. They might not have seen the best research. I have a 15-year-old son now. My IVF baby's a 15-year-old son. He's out driving. I'm like, you can't rely on the other cars to do what they're supposed to. You have to, before you go into the intersection, make sure it's clear. Because if they, you know, blew it, even though they were wrong, like, not a good day for you. And it's the same,
Yeah.
same as for healthcare, is where we need to advocate for our own healthcare. We need to have ownership and understanding of what's going on with us. That makes us a better patient, to have a better conversation, to find a doctor who we can have active conversations to find the right solution faster and, you know, more effectively, cost effectively, time effectively than if we didn't. And so it's just having that education. I told you, I had 21 years of schooling. I never learned about my menstrual cycle, and I'm a hormone scientist. It's crazy.
Wow.
You know, we just don't get this thing in school.
Yeah. I mean, talk about just an insanely underserved and under-considered market. 85% of women, you said, have hormone imbalances related to periods.
Yeah, and you know, PCOS, endometriosis, ADHD actually has a correlation with hormones now. They're finding out,
Wow.
you know, health things later in life. Alzheimer's, osteoporosis, heart disease are basically your risk is low. You go through menopause, all of a sudden it kind of skyrockets. And if you take hormones at the right time, you can reduce your risk and live a more healthy lifestyle longer. So it's more of a health span as opposed to a lifespan. So a healthy life as opposed to sitting on your couch because you can't move because you feel miserable the whole time.
Yeah, awesome. So it sounds like there's kind of three key phases in life corresponding to when folks should start working with you. You know, if they're having struggles with their monthly cycle, if they're struggling to get pregnant and premenopause. Is that accurate?
Yep, that's perfect.
Cool. So anyone listening, you know, who of the female persuasion who looking to improve this area of their life, they should look to you. Is that accurate? Okay.
Yeah. And if you're a male and you have a female in your life that you're like, oh my gosh, this is totally her, whatever.
Good call. Yes.
I jokingly, everyone, the women aren't as intimate and they don't want to have as much sexual relations as they get older because their hormones are just a disaster. And
Mm.
it doesn't, it's not that they don't love their family or whatever. It's just their hormones are just this havoc, you know? And so helping her have a balanced cycle is going to make the entire home environment a better environment. And so if you are a male and you have somebody in your life that is a female and you see any of this kind of thing happening, it's okay to tell her about. I had many men were like, how do I, my wife needs that. How do I tell her without being this asshole? And I'm like, you love her and you want the best for her. And you say,
Mhm.
hey, are you struggling with your hormones? Like I heard this thing, like, hey, maybe you should go check it out, whatever. So don't be afraid.
Yeah. Is the most common customer dealing with their monthly cycle, working on getting pregnant or premenopause, or is it sort of even across the board?
It's mostly trying to get pregnant, and that's kind of where we started and where we've had the longest time in market. But it's also where women really start to care about their hormones, I guess. It's not until they're trying to conceive, and that's a thing that you do when you're trying to conceive is measure hormones to know when you're
Mm.
ovulating. And they're like, oh, maybe I have, any hormone imbalance. Oh, I'll get PROOV and I'll try to understand like more than just like the basics of what an ovulation test would do. And so we see a lot of people coming in at that period of time, but it's so much more broad and important for the vast majority of women that I would support anybody coming in and learning about their cycle, taking those first steps. I mean, the menstrual cycle is a fifth vital sign. And so we all have, blood pressure, heart rate, those kind of things. Women have a fifth one, which is the menstrual cycle. And the menstrual cycle is designed to support another life. And if there's something out of balance in your body, it's your brain's way of pulling resources from the menstrual cycle saying, hey, you're not ready to conceive a child because we have to deal with this heart issue or this
Mm.
bone issue or something else, high stress, whatever else is going on. And so if your menstrual cycle, if you have heavy periods or painful periods or you're spotting or you just have really bad mood swings or whatever, it's your body's telling you something is not healthy in your system. And so if you can support your body's menstrual cycle to have a healthy one, that's like the ultimate health metric is a healthy menstrual
Mm.
cycle. So if you have a
Mm.
healthy menstrual cycle, you're probably pretty healthy.
Yeah. Yeah, that's awesome. Okay, my final question for you is an open-ended question. You take it in any direction that you like. What are you working towards?
We are working towards understanding what hormones mean to find personalized solutions. Getting the lab results, getting the blood test, the hormone level is one thing, but understanding what that means and how to fix it is something totally different. Like there's companies out there that are like, we're going to test 1001 markers and you're going to get this big report of all these things. And you're like looking at this like, I don't know what that means. A lot of the things in hormone world, we don't know what it means yet because we just now have a tool that lets us collect the data. We still don't understand it. And so we're working on building a big database of hormone levels and symptoms and age and ethnicity and all kinds of stuff to really, really understand. If I tell you my hormones, you are going to feed out the exact thing that I need to get back like that immediately. No more like, trial and error, try this dose, try this thing, try that. Like we'll just know. So that's the biggest thing we're working on is truly unlocking the menstrual cycle and using it as the superpower that it should be and optimizing the menstrual cycle.
Yeah. Wow. That's incredible. This is really powerful work, and you're helping just literally half, at least, well, the whole world, because we all love someone who's a woman, but directly positively impacting literally half of the world or more. So that's amazing. Thank you for doing that. This was really cool. You blew my mind. I had no idea about any of this stuff. And me and my wife, we're going to start trying to get pregnant here soon. So we'll definitely be reaching out.
Yeah, one piece of advice for you guys, it's better to find answers on day one than, 366. There's,
Mm.
Healthcare is like, well, just try it by yourself. It takes a while, wait a year. And it's like, by the time you get to that,
Yeah.
our society, they need to rewrite these rules because our society is like, I don't even want to go get lunch. I'm going to Uber Eats it to my house. How am I going to wait a whole year to have a baby? Like, no way.
Yeah, absolutely. Where can my audience find out more about you and PROOV? PROOV.
PROOVtest.com is our website. We're on Instagram and on Facebook. One of our pillars is education. So we have menopause groups. We have our perimenopause groups and fertility groups. Come in, ask questions, get educated.
Awesome. We will link those in the show notes. Amy, thank you so much for taking the time away from, you just got a new puppy as well, 9.5-week old Xena. Appreciate you taking the time.
Curled up next to me taking a nap.
We wore her out just in time for the show. This was amazing. Thank you so much for taking the time.
Yeah, thank you.
To all our listeners out there, thank you so much for tuning in, and keep on growing out there, everybody. See ya.